Welcome back to What's Now. Your cardiovascular health should be at the top of your list. Many Americans struggle with cardiovascular difficulties, and there's a new medication to help with the risks of cardiovascular disease. Here's more.
Cardiovascular disease is the #1 cause of death in both men and women, but a new FDA approval for a medication could reduce cardiovascular health risks and benefit millions of Americans. Joining us today to discuss is Dr. Deepak Bhatt, Executive Director of Interventional Cardiovascular Programs at Brigham and Women's Hospital. Welcome to Park City Television.
Great to be here.
So, Dr. Bhatt, why are so many Americans at risk of cardiovascular disease?
Well, there are a lot of different reasons. One is that many people have an unhealthy diet or don't exercise enough or are overweight or obese. But even beyond that, there are many different risk factors for cardiovascular disease that are highly prevalent. Things like diabetes, high blood pressure, smoking, and in particular high cholesterol. And we've been really effective, I think, in terms of targeting high cholesterol with the use of statins. Those are medicines that are proven to reduce cholesterol and the associated risk of heart attack. And most recently, what we've discovered in a large clinical trial called Reduce It is that triglycerides are also a risk factor for heart disease. And these are sort of like cholesterol, a fat in the blood, but a bit different. And in the Reduce It trial, we found that a prescription medication called icosapent ethyl reduced the risk of things like heart attack and stroke and dying from those causes by 30%. So a pretty large reduction in risk in people with elevated triglycerides who also have other risk factors for heart disease.
And how can you know if you are at risk?
Great question. So the first step is to see, do you have elevated triglyceride levels? And the good news is that test is basically always obtained when you get a cholesterol test. So if someone has a cholesterol measurement that's been made, there's also a triglyceride measurement. Now it turns out that doctors haven't been paying much attention to triglycerides for the past couple of decades because there wasn't any treatment that was effective at both lowering triglycerides but also then proven to reduce cardiovascular risk. So really for the first time in the Reduce It trial, we've shown that a drug, icosapent ethyl, that lowers triglycerides not only does that, but more importantly, reduces the associated cardiovascular risk. Again, reducing things like heart attack and stroke and death from those causes by 30%.
So I'm curious, Dr. Bhatt, why is this such an important advancement in preventative cardiovascular care?
In my opinion, it's probably the biggest advance in cardiovascular prevention in the past 25 years or so since statins first came on the scene and were shown not to only reduce cholesterol but also reduce the risk of heart attack. And we've basically done the same thing, although now with triglycerides and the prescription medicine icosapent ethyl. So what we've shown is that if your triglycerides are elevated and you have either established atherosclerosis, that's the fancy medical term for plaque buildup in the arteries to the heart or the brain or the legs, or have elevated triglycerides and diabetes plus a couple of other risk factors for cardiovascular disease, you can derive a substantial benefit in terms of reducing future risk for cardiovascular events like heart attacks and strokes by taking this prescription medicine. In fact, the U.S. Food and Drug Administration just last month approved the drug for this indication. So it's a really big advance in cardiology.
And how can people access the medication as well as the cost-saving benefits?
Yeah, that's an important question. So this is a prescription medication. It's a prescription omega-3 fatty acid. So it's different from, say, omega-3 fish oils that you can buy as a supplement in the store. Those haven't ever been shown in any large trial to reduce heart attack and stroke risk. What we're talking about here is icosapent ethyl. It's a prescription medicine. So the only way to get it is to go to your doctor and see if you're eligible. And so really the next step, if anyone were curious or interested, would be make sure you know your triglyceride level. Everyone should do that, as well as your cholesterol level. And if the triglycerides are elevated, then potentially ask your doctor, might I be eligible for this prescription medication?
So it's really essential to make sure you're getting your yearly physicals.
You know, it's something that isn't as popular, I think, as it used to be maybe 10 or 20 years ago, but I think that annual physical is really important, especially when it comes to things like heart disease, because most of the time it doesn't cause problems until it causes problems. That is, you can feel great and have heart disease and not know it, and then one day out of the blue have a heart attack or a stroke. So, that's a risk, especially as people get older, especially if they have risk factors for heart disease, what I mentioned at the beginning of this segment. So, especially for those sorts of people, important to go in and just have your doctor check you out and at least check the basics. That is, are your cholesterol levels high? Are your sugar levels high? Is the blood pressure high? Is the weight high? And now I'd add to that list of essential measurements, are the triglycerides high?
Well, this is potentially life-saving information. Where can we find out more?
Well, if someone wanted the details of that clinical trial I mentioned, Reduce It, it was published in the New England Journal of Medicine, so you can go to that website. If someone wanted details of what the drug is actually approved for, I summarized it, but if they wanted details, they can go to the FDA website. But probably the best place to go really is to your physician and see, A, do you have elevated triglycerides, and B, if you do, are you then a good candidate for this new prescription medicine, icosapent ethyl?
Well, thank you so much, Dr. Bhatt, for talking with us today. Definitely great preventative information.
Thank you.